So thank you very much, everybody, for joining us today. It's a great pleasure to be asked to chair the Great Ormond Street Hospital Biomedical Research Centre Showcase. I spent the last 7 years organising it, so it's quite a pleasure not to do that this time. But I know the team have worked very hard, and we're looking forward to a great afternoon. A few housekeeping things to get together at the start. So you can submit questions at any point on Slido. You could scan the QR code and you will see this throughout the presentations. We're not expecting any fire alarms or drills, so if one goes off, please exit calmly by the nearest exit. You can connect to Welcome's free Wi-Fi. The network is called Welcome Guest. Can I remind everybody, please, to put their phones on silent so we're not interrupting any of the speakers. Welcome to those joining online as well. I'm looking to see if I could see them, but I can't. So somewhere there are a lot of people online. I think we had about 400 people sign up, so there will be quite a large number online as well. Remind to the people online, you can turn on subtitles if you wish. The facility is there on the system. The event will be recorded and photographed. If you don't wish to be photographed, I think you were asked when you joined at registration, but if you don't wish to be, you can pop out and get a sticker to put on you, and that would just remind people not to photograph you. Can you please keep an eye on your personal belongings? We have the ticketed cloakroom, but we can't take responsibility for them. Housekeeping over. So it's a great pleasure to introduce, first of all, the director of the Great Ormond Street Hospital, BRC, Professor Thomas Voit, to give us some opening remarks.
Hello and good afternoon, and maybe good morning or good night to many of those online. Thank you for coming. We want to give you a showcase of what we're doing in the BRC, and I'll start with a brief review if this is working. So just to state our general mission, we really want to transform the health of children and of the adults they will become. And in doing so, we want to develop cutting-edge top science, world-leading clinical trials, and we want to accelerate discovery of new treatments for the children with rare and complex conditions. And we want these inventions, these developments, to have an impact worldwide. So who are we? For those who don't know the Biomedical Research Center so well, we have a total of 5 themes. All of these themes will be presenting to you, so I won't say too much of them about them, but they are all centered around methodologies. We're basically based in 3 buildings: the Great Ormond Street Hospital, the Great Ormond Street Institute of Child Health, and the Syed Center for Research into Rare Diseases just next to them, all together. And we have a strategic alliance with 3 other children's trusts: Sheffield's Children's Hospital, Birmingham's, and Alder Hey in Liverpool. And you will have presentations also from Birmingham and Liverpool today. We also have, of course, more translational topics and themes which are around patient and public involvement and engagement, our career development academy, business development, research communications, which I'll also present to you today, and equality, diversity, and inclusion. All of these make a big machinery run and work, and they are, if this ever moves forward, yeah, okay, just needs a lot of determination. They're all centered on method development. So I just want to make this point really clear. Most BRCs in the country, if you ask and look around, are centered around diseases. So they will have topics like cardiology, lung disease, cancer, and so forth. We're not. And the thinking behind this is that we've always maintained that science is driven by methods and method development. And so our unique selling points, if you want, are also very much focused around methodologies. And for example, we have the Science Center that is housing the largest academic GMP facility in the UK, where we can actually produce our own drugs. And in conjunction with this, we have a very active pipeline of investigator-led phase 1 trials. So not industry-led, but investigator-led, that are coming out of our own translational research. We are developing drugs for ultra-rare disease. We're currently thinking about N=1 trials for very rare diseases to prove new proof of concept. And we're working a lot on complex gene and cell therapy approaches. Some of this will be presented to you today. Equally, you will hear about the advanced use of genomics and AI in healthcare. So a lot of the BRC is focused on the next generation of researchers. This is how research develops in general, but we have a particular belief in the worth and value of supporting young researchers. And we have set up a scheme which allows us to support them all along the way. So we start actually very early, even at the school level, but then we have funding schemes for pre-doctoral internships, PhDs, postdoctoral development, and particularly also fellowships, which are supposed to bridge the gap between the postdoc stage and to very competitive fellowships outside. And as those who are living in the academic world know, the real problem in academia is to get a long-term perspective. And that's a very difficult and competitive process, and we want to develop and support young and mid-career researchers as much as possible on that way. And there's a financial side to it. And I won't go much into money, but if you think we get about 7 million per year from the grant, out of which more than 6 million go towards competitively awarded projects. So it's not just money doled out, it's money that always enters into competitive processes. And if you just look at what we've done this year, 63% goes into early and mid-career researchers of that money. So it's 2/3. And 1/3 goes to individual project funding. And all of this is competitive. Now, are we successful? Yes. I'm happy to say we've managed to secure 10 prestigious external fellowships recently. I won't name them all, but give you some examples here. And you see that they come from all different areas, like the Wellcome Trust, UKRI, the MRC, and as all in academia know, it's quite difficult to obtain these fellowships, so these are all big successes. We do not only support clinicians and biologists, PhDs, we also strategically have supported, even for a long time now, allied health professionals, which means nurses, psychologists, physiotherapists, all the other professions that help us to really bring translational medicine to the clinic. And one example is Polly Livermore, who is a nurse by training, who obtained her first NIHR fellowship in 2017, then got a Skills Enhancement Award in 22, and then landed a big NIHR program that will last until 26. And that shows you that not only as a biologist or as a medic, but also as an allied health professional, you can really develop very successful in research. Another topic is it worth spending quite a bit of money on these in-house, even if competitive fellowships, like Catalyst fellowships? And the answer is clearly yes. The Catalyst Fellowship scheme has been very successful, and two examples are here. Julien, who will also speak today, got his first MRC Fellowship Award in 2020, and now a follow-on award from the MRC. And Jenny Chandler got a Kidney Research UK Intermediate Fellowship, both following a Catalyst Fellowship. And that's the way we want to be able to support people for them to move forward successfully through an academic career. Now, how are we doing otherwise? Of course, we're using all the NIHR infrastructure money we are obtaining in order to support our research, but also support it more widely. And if you look at our overall leverage, we have quite regular income of external grants of about 50 to 60 million per year. You see, and we're not the only ones, that there's a slight dip after COVID and Brexit. Both were not very favorable for the grant landscape, but clearly we're recovering from that, so that's looking good. And I think we're overall on a very stable trajectory. So I'm very happy that a lot of the research that's coming out of the BRC today will be presented to you by early and mid-career researchers, so by young people. That's how it's supposed to be. I'm very grateful that they are all here and contributing. And with this, a big thank you for your attention, but a very big thank you to all our patients and families. Without them, we couldn't do anything in research. Thank you, and over to the next one.
Sorry, we're just trying to play a short video we have from some of our young people.
Welcome to the NIHR GOSH BRC Showcase 2025.
We are GOSH YPAG, and we believe that children and young people should have a say in how child health research is planned and carried out.
We are GOSH YPAG. We help improve research projects by giving our views and opinions to researchers to get them to think about the young patient at the centre of their research.
We are GOSH YPAG. We want researchers to remember that involving people like us in their work can only change it for the better. We hope you all enjoy the GOSH BRC Showcase Day.